Like many expectant mothers, Pat Eyaba could not hide her excitement. But after the birth of her baby, she couldn't explain the wave of sadness which engulfed her.
I was more happier when I was pregnant than when I gave birth. That is my first issue. I'm supposed to be excited. I'm supposed to be over the moon, but this is me. I'm always moody. If I go to the bathroom to bath, in 1 hour, 30 minutes, I'm still there. What are you doing? Nothing. At times I would just be crying. I mean, I'm crying. What are you crying for? There was a day my son was crying and I started crying. I was just crying. Why are you crying? I don't even know. That first 2 months was not easy. It was not easy, but I'm glad that help came. But imagine people that...
Such behavioral pattern experienced by the young mother, experts believe, could be symptoms of postpartum depression, a condition which affects 1 in every 7 women, according to global data.
Is that most of them, they feel unworthiness, that they're not worthy, kind of a conscience, lack of pleasure in things that were earlier enjoyable, and feeling disconnected with their babies. They distance themselves from their babies. They push their babies away because they feel, the baby is the cause of their pain. Most of them might have like guilty conscience, inferiority complex. They feel all these things that were not there before.
The lack of spousal support compounded Sunshine's situation. Another mother who chose to share her story on a chat platform. In her own words, it was a traumatic experience. Despite the high rate of women affected by this condition, this mental health advocate believes that there is still a poor level of advocacy on its existence, especially in Nigeria.
And this is because of what I said earlier, how persons with mental health conditions are not free, do not feel accepted by the society, who do not see their conditions as health conditions, but as a disease that is contagious, as a disease that should be distant from. So these are problems that we have.
Then try to identify
The director, FCT Primary Healthcare Board, Dr. Yakubu Mohammed, explains
and
how
then
his agency tries to
set up
address this
establish a
issue
good
by
referral
enlightening
network
pregnant
to
women
identify this
during their antenatal classes.
builds. We have trained our primary healthcare workers, particularly the nurses and midwives, because a bulk of the services at the primary healthcare facilities is focused on maternal and child health, to be able to, while they provide services, to be able to identify those just basic elements of mental health. For the primary healthcare worker, haven't identified that this mother has postpartum depression, to refer.
Studies have shown that cases of postpartum depression often go underreported and underdiagnosed. This is why policymakers in the health sector should consider this as a medical emergency which needs utmost attention. In Abuja, Toiba Anifoshe, NTA News.